Good afternoon all, and a very warm welcome to South Sefton CCG's annual review 2019-2020. Can we go to the next slide, please? I'm Craig Gillespie. I'm a GP in Crosby and I'm chair of the CCG. I have with me today as co-presenters Fiona Taylor, Chief Officer of the CCG, and Martin McDowell, Chief Finance Officer. Next slide, please. So a little bit about today's event. Firstly, this is our first ever virtual AGM. You'll know that under usual circumstances, the CCG would run our very successful series of big chat events where we meet with and listen to the public. Clearly, during the pandemic, this needs to be virtual this year, and I think we're all hoping that normal services can be resumed in 2021. Next slide, please. So what we'll cover today, so I need to advise you, I think have we gone one slide further on? No, backwards, please. That's it, thank you. So I need to advise you today that we're recording today's event. And that is available for viewing at any time on our website, and I'll give you the details for this later. We will be presenting an overview of the year 2019-2020, and we received some questions that have been submitted by the public that the presenters will answer towards the end of the meeting. Next slide. So today I'll be starting off with an introduction and my highlights. Fiona will provide an overview of our year, and Martin will describe the financial performance of the CCG. This will be followed by a question and answer section. Finally, we'll close with a short animation that describes our year pictorially. Next slide. So we can start with my highlights. Even before the coronavirus pandemic, if you can recall such a time, it seems like a long time ago, it was very pleasing to me to see that our member GP practices were taking an increasingly central role in shaping local health services and transforming care. Traditionally, general practices have operated largely in isolation from each other. However, 2019 saw the bonds between practices strengthening and as emerging primary care networks matured. This prompted new ways of working with increased digital access such as e-consult and the development of new professional roles that you'll start seeing in primary care, such as direct access physio and the clinical pharmacists that are supporting general practice teams in prescribing. And of course, there's the pandemic. I'm very proud of how the whole of the NHS and the population have responded to the crisis. General practice teams have responded swiftly and effectively to keep patients and staff safe whilst continuing to provide great healthcare. And going forward, I'm certain that general practice can rise to the challenge of the mass vaccination programme. Next slide, please. So, although we have been unable to meet face-to-face for the first time today, I do hope that you'll find our presentations informative. And you'll see from the slide that the further information is available on our website, which is www.southseftonccg.nhs.uk. I'm now going to hand over to our Chief Officer, Fiona Taylor, for her review of the year.
Thank you, Craig. Next slide. I'm going to talk through some of our achievements in 2019-20. Before I do that, I just want to echo the Chair's comments about the work that's happened over the last 7 or 8 months due to the pandemic, and just a huge thank you to all the staff that work within the NHS, which I know our public every Thursday in the early days, the wave one clapped, and that was really morale boosting, I have to say. Stood on my own doorstep listening to that really made it very worthwhile to work in the NHS, and all the key workers across the different services. So working in the last 6 months, we're actually going to take, as Craig has said, a step back before that into the year that ended at the end of March. And these are some of the achievements that we're proud to demonstrate through our AGM that we've achieved up until that point and continue. So we came to the end of December last year with a quite substantial piece of work alongside our partners in the council to develop our 5-year plan, which we've called Sefton Together. And this really is the bedrock of the building block almost of what we're doing in the community of serving our residents in Sefton as we go forward. Quality of care is really important, and of course we've now got some of the best performing organisations in and around Sefton that we commission with, we buy services from, and we're also seeing year-on-year progress in terms of earlier diagnosis and survival rates for cancer, but there is a lot more that we need to do. And during 2019-20, we were also proud that we received an award, so a national recognised service in the work that is undertaken in South Sefton through the Trans Health Sefton service that Dr. Anna Ferguson leads. And also we were finalists with our local authority through the Local Government Association Awards for a service called Supported Living, which supports some of our most vulnerable members of our communities. So that was really pleasing to be able to share with you as our public. Next slide. So this is Sefton Together. As I say, it was developed towards the end of the year 2019. It was our response to the ask of NHS England and the NHS long-term plan, and our strategy. You know, it's really important that this document is brought to life. It's not just a document, it's actually what we're aspiring to do and our ambitions for you as our residents within Sefton. And it's all about where we started off in 2013 as a CCG in shaping Sefton 1 to really set a vision for much more integrated health and care wrapped around you and the communities, and making sure we could bring care closer to home. Next slide, please. So what we want is that all our healthcare and the wellbeing services are more joined up, as provided as close to our local communities as possible. We want to help our communities to make positive changes and to live lives and make your lives as easy as possible by getting the right support in the right place, the right time, first time, so that you can live longer, happier and healthy lives. Next slide. So developing Sefton Together, we were thinking about our working together differently, working much more collaboratively. And so the plan was brought together, working actually with the auspices of the Health and Wellbeing Board, and the Health and Wellbeing Board strategy, Living Well in Sefton, was being refreshed at that time. So we made sure that the two things dovetail together, so the residents of Sefton are getting the best and benefit of joined up services and joined up organisations. And of course we did those events with the views of our residents and our public, as well as our stakeholders and other partners, of which our community voluntary faith sector are really at the heart of everything that we think about within the CCG, because we're really lucky in Sefton to have a vibrant sector. Next slide, please. So these are some of our partners. Obviously, you've got the NHS partners, our council, our primary care networks, as Dr. Gillespie has said, and our community voluntary faith sector, as well as our regulators in terms of NHS England and also our integrated care system at Cheshire and Merseyside Health and Care Partnership. And I'm very grateful to all those partners for all their contribution to the work that we do in Sefton. Next slide, please. So things are changing, the NHS never stands still, and we're moving towards being part of the bigger regional system known as I've just said, the Cheshire and Mersey Healthcare Partnership. But really importantly is that this work is rooted in our borough of Sefton. Sometimes people call it our place, but it's known as our borough. And we, as I've said before, the golden thread is the care that we want to provide to our community by us all working together to transform those services. Not one of us can do this alone, and we are better when we're working together. Next slide. So this looks like an inverted triangle on a diagram. What this diagram shows you is that the majority of work is within the Borough of Sefton, within our neighbourhoods and our communities. It's about working with our council colleagues in terms of their 3 locality model across the Borough of Sefton. We've got 8 localities and 7 primary care networks that actually recently have reduced to 6 primary care networks as 2 have come together. And working with our population at a Sefton level, and then, as I've just said before, around our bigger piece of work with Cheshire and Mersey. And over the next 12 to 18 months, those changes will start to materialise. But what we will be focused on as a CCG, working with the primary care networks, is our 80% of what we can do and spend our money in our borough of Sefton. Next slide, please. So the elements of Sefton Together are around developing our primary care network, supporting them to flourish and mature, to be the leaders in the future, working to pull all our providers together in the Sefton Provider Alliance to make sure we can do things much more collectively together and spend the Sefton pound in a very affordable and effective way. Making sure when we're commissioning things and planning things that we can do that much more aligned with the local authority in Sefton Council. And where we've got acute and specialist services is making sure we work to ensure that those services are sustainable for our population. Next slide. So all of that happened in 1920, and what we also did at the back end of 1920 was our usual Big Chat 11 and our annual review, and we asked views on what you thought about our 5-year plan, Sefton Together, and what you thought about improving outpatient appointments and self-care, because a lot of this plan, Sefton Together, is around how we can promote self-care within our communities. We also did some work around reviewing local health policies and again making some of our opportunities easier to help when practitioners are needing to work with our public. So continuous glucose monitoring systems, we've got diabetes, cough assist devices, so again using those more effectively, and insulin pumps. They were some of the things that we look to improve our policies in order that the people who have that sort of care could access that easily and more for them for the future. We also, as I've said, worked collaboratively with partners, and that was also encouraging down at practice level patient group development, which I know is something that in our big chats our public have fed back that they would like much more involvement and engagement in general practice. Next slide. So I'm going to hand over now to Martin McDowell, Chief Finance Officer, for our performance. Thank you. It looks like we might be having a little bit of a technical difficulty here, guys. So if you just bear with us while we look to take the mute button off Martin, then he can do his presentation. We'd be very grateful for that. There you go. Thank you.
Okay, thank you. If we can move on to the next slide, please. So, sorry, go back one, I think. Oh, no, sorry, yes. So, overview of our performance. So, we had a budget of £280 million, which equates to effectively £1,795 for each South Sefton resident. At the end of the year, the CCG reported an £8.9 million deficit, and this represented a deterioration from the £1 million surplus that we reported in the 2018-19 year. External audit undertook a review of our accounts. They found that the accounts presented a true and fair view of the CCG's financial position, in that it was accurate. They also looked at our value for money arrangements and concluded that we had appropriate value for money arrangements in place in terms of how we spent our money, except for how we delivered against our savings plan. So as a consequence of not delivering on our savings plan, we ended up with a deficit which was £8.9 million, and therefore that was recorded in the annual report as an except for arrangement in terms of meeting our value for money arrangements. From a performance perspective, the CCG maintains its requires improvement rating in our annual assessment. Fiona and Craig have both noted some of the highlights of the year so far. So again, some of the things that we did, we were able to really improve services for patients, and it's pleasing that we were able to do that during increasingly challenged times. So again, the work that we put in through the year enables us to end up with a requires improvement rating the same as being 2018-19. Next slide, please. So in terms of how we spent our money, this is our usual pictorial representation. You'll see that on the right-hand side, mainly green part of the chart is acute services at 51%. Working our way around the chart from the bottom, community services 12%, continuing care 5%, mental health 8%. I would note at this stage that there are other aspects of mental health spend contained in other parts of the pie chart, notably within the community continuing care and prescribing elements. 10% of our budget was spent on primary care, along with 10% on prescribing, and that's the prescriptions that are issued through our community pharmacies on a regular basis. 3% on our programme costs, and then finally a small element, 1%, to contribute to the running cost of the CCG. Next slide, please. So in terms of improving performance, we work hard to continually improve services. Areas of focuses that we looked at during the year included access and recovery rates for our talk and therapy service, an increased uptake of annual health checks for residents with learning difficulties, an improvement in our appropriate prescribing of antibiotics through our primary care arrangements, and improved care for those with long-term conditions. Okay, and at this point, I will hand back over to Craig to introduce the question and answer session. Thank you.
Thank you, Martin. Those of you who have attended our Big Chat events in the past will know that they're interactive events. However, on this occasion, because today's event is being recorded for broadcast, we have requested that questions would be pre-submitted. Conveniently, we have received 3 questions, one for each of the presenters. So we'll go to the first question, please, which is for Fiona. So, there is a bow wave of health problems building up that needs to be planned for. There is also the question of urgent strategic NHS plans that have had to be delayed. I would expect that the challenges over the next 3 years will be greater than those planners have had to deal with. What is being done to plan for the short-term and longer-term challenges we are likely to face? This question comes from David Sutton, and I'll hand over to Fiona.
Thank you, Chair. So thank you, David, for the question. And I think there's a couple of parts to this. So I think you're absolutely right, David, to point out that there will be challenges, and we will rise to that challenge as always. So it's appreciated that there's a number of potential pressures on future demand. During the late summer, the NHS worked to resume health services from wave 1, and we were getting back on track. And then obviously wave 2 of COVID-19 pandemic has interrupted some of that restoration of services. That we were starting to see GP referrals increase, particularly around some of our cancer referrals. But wave 2 has actually meant that some of our services are under pressure again. So we're trying to understand with our hospital providers, our community providers and our mental health provider, Merseycare and Luft, Liverpool University, Southport and Ormskirk and Lancashire Care, what some of the challenges are. And we also have a few services delivered by North West Boroughs as well. So there's a real focus still. The NHS is in command and control situation still, and we will work very closely with all our colleagues to make sure that we can resume services as quickly as is possible. But I think it is reasonable to say that that is going to be quite challenging. So particularly we're seeing demand in mental health, children and young people's mental health, and we will work, as it says, in terms of some of the ambitions we had within Sefton Together to focus on meeting some of this demand. A lot of focus in Sefton Together is, which we agreed last year, as I've said before, was focusing on reducing health inequalities, and that is particularly alongside prevention, very current, and will continue. So when we co-produced the health and wellbeing strategy and the Sefton Together plan, we were really keen that we focused on the whole life course and really tried to address the issues of reducing health inequalities. And I think, as many of us will have seen, COVID-19 has put a real spotlight on health inequalities because some of those gaps have actually widened. So we need to have a think about how we might have to reprioritise our approach and, you know, in the medium term to achieving that. I think as well, I would also say we've also taken some proactive steps to expand our service offer. So I was saying about pressures on mental health, children and young people and primary care. We've looked to increase some investment. So Cooth's a really good example. It's a digital platform for children and young people to access in relation to support with their mental health, emotional well-being, and we've increased investment in that, and there are other elements of increased investment that we put in as we needed to support that. So in conclusion, I guess with this question, we're working really closely with all our partners, health, social care, public health and the rest of the council, and our work with the community voluntary faith sector through the leadership of the Health and Wellbeing Board. We'll continue to review what's coming nationally and locally from Cheshire and Mersey, and keep that real focus, as we always try to do in the CCG, on the needs of our population. And I guess what I would say with this one, it was about planning, but I also think, David, and to all our public, those three messages about washing our hands, keeping our distance and making sure we do wear a mask are really important to help us to support the demand and reduce it in terms of health service and care generally across our care homes, who've done a tremendous amount of work in Sefton. So I hope that answers your question, David. If you feel that it's not and you want a bit more, then feel free to get back in touch with us and we will happily take any further question. Thank you. Pass you back to over to the chair for the next question. Thank you.
Thank you, Fiona. So the next question goes to Martin and is Crosby Town Centre Primary Care Centre Hub. The Crosby Town Centre Action Plan prepared by Sefton Council in 2017 alludes to the public estate strategies in development, needing to consolidate and plan for modern services, and the Joint Strategic Needs Assessment relevant to joint working around hubs and co-location. It is further understood that this is a concept which South Sefton was exploring with NHS England, but nothing further has been heard lately. And then there's a note that the Crosby Village Surgery in Little Crosby Road has been closed recently due to the coronavirus pandemic and has amalgamated temporarily with Crossways Surgery in Waterloo. So the question is, so what is taking place and when and how might such a facility be delivered? This is from Adrian Swift, and I know Adrian's got a particular interest in general practice estates in Crosby. So over to you, Martin.
Okay, thank you, Craig. So we have been discussing potential developments with a number of partners across the local area, including the Crosby development that's taking place. Our main constraint at this stage is the lack of capital available to fund NHS primary care developments. So what this means is the CCG has been discussing options which will require an additional revenue contribution from an already stretched budget. So I've already reported that the deficit in 2019-20 was nearly £9 million. We would have to make some inroads in that to help sort of finance the buildings that we want to deliver alongside our corporate partners. So discussions remain ongoing at this stage. No firm plans to enable co-location to take place, although it still remains an ambition for the CCG in the future. And at this point, I'll hand back to Craig for the next question.
Thank you, Martin. So the next question is again from Adrian Swift, and this one falls to me. The Frome project. There have recently been reports about the successes this project has brought, involving joint working between the local CCG, social care services, the voluntary sector and the NHS. Led by the local CCG with a specific funding allocation, the aim has been to reduce pressure on the NHS, particularly hospital admissions and services, and improve health and well-being in the community. Likewise, might similar working arrangements, good practice, be adopted in the South Sefton CCG area? So thank you, Adrian, for your second question. So for those who don't know, the Frome project is described as a model of enhanced primary care. It's widely recognised that the wider determinants of health, social and psychological factors have a great influence over the overall health of an individual. The Frome project connected people to community services, whether that be NHS, local authority or community, voluntary or faith sector. They support the individual's needs in a more holistic way, and as a consequence, they did achieve good outcomes. One of the interesting things about the NHS is that whilst a project such as that seen in Frome makes all the headlines, in truth, it's likely that most other health and care systems in the country were doing very similar projects. Certainly this is true in Sefton. As you've heard in Fiona's presentation and her response to the earlier question, there's a wide range of partnership work being progressed through the delivery of our Sefton Together strategy, which in turn supports the work of our Health and Wellbeing Board. This work is collaboration between CCG, Sefton Council, local providers and community, voluntary and faith sector. And it's focused on supporting residents within the community to promote good health and well-being. I've got a number of examples to share with you. Our ICRAS team, ICRAS stands for the Integrated Community Reablement and Assessment Service. It is a rapid response service provided by health workers, therapists and social care support, and it's for those at risk of hospital admission and to also support early discharge from hospital. Our community integrated care teams are made up of GPs, therapists and nurses, and again linking in with the voluntary sector, and they're providing proactive support to residents. Further, our primary care networks are forging strong links with the voluntary sector, and through Sefton CVS are employing social prescribing link workers who provide holistic and proactive support. And finally, the life rooms in Bootle are a safe and welcoming space where people can meet and can access learning opportunities and community resources. And of course, there are many other examples of collaborative and holistic work locally. It's not just limited to the examples I've given you. There's loads of other good work being done elsewhere. So next slide, please. So finally, I'd like to thank you all for taking the time to join with us today. Our annual report is available on our website, and you can see there that it's www.southseftonccg.nhs.uk. I'd like to leave you with a short video, which is of our year in pictures. Thank you.